Dr. Sarah Song will provide takeaways to make you a stronger advocate, because that's an essential skill that will benefit every single one of us. So please join me in welcoming Dr. Song.
Hi, so great to see everyone. There's quite a lot of you out there. And thank you for that awesome music when I walked on. I am so happy to be with all of you to share some practical tips and takeaways for advocacy. I know that everyone has had a little bit of a different path, but I can say that without a doubt, being an advocate has made me happier. And it has given my professional life more meaning. I feel like I have made an impact in my own small way. So I want to first make it clear that advocacy can look really different to a lot of different people. It can happen anywhere, and it can go in a bunch of different directions. And you might even be wondering what advocacy really is. Advocacy is simply the act of speaking up and acting on behalf of a cause. And now whatever that cause is really up to you, and it's really whatever you feel passionate about. However, I think I can safely say that as neurologists, we all value certain things in the course of our daily work. We value things like quality, evidence-based care, compassionate care for our patients, access to medications and treatments that our patients need, and for our jobs to not become so prohibitively difficult with paperwork and red tape that they prevent us from doing what we do best, which is to take care of our patients. And it is in this realm, as serving as a neurologist, that I want to talk to you about how we can channel all those emotions and wants and just put them towards a concrete ask. And I want to equip you with the skills you need to feel confident to put your ask into action. Of course, not everyone needs to give a testimony in a Senate hearing, and advocacy can be a lot smaller and a lot more personal than that. It really just starts with an idea or a problem and a potential step towards a solution. So, what is something that you want to make better? What is something you notice in your daily practice that could be tweaked to make your patients or your colleagues' lives better? So now that you've identified an issue, what are you going to do about it? Maybe you're going to create pamphlets to educate your patients about a topic you feel passionate about. Maybe you streamline communication in your institution between care teams so that your patients can see other consultants faster. Or maybe you increase the visibility of what you do as a neurologist in your community by testifying at a county hearing or being interviewed by a local news reporter. Maybe you decide to take on a leadership role in your institution or in a local nonprofit chapter or in a state neurosociety. For our international members and attendees, you may have similar or different issues that we have in the US, but I would argue that advocacy is a skill that is universal. It is a muscle you can work on, that you can flex, and once you start thinking of ideas, I venture you're going to be using advocacy skills in ways you never expected. All right, so let's say then that you get the opportunity to get in front of your legislator and their staff. Let's say you have an issue that you're really passionate about and a story to tell. Maybe it's a story about your patient, maybe it's a story about your dad, or maybe it's a story about your daily work as a neurologist. Either way, keeping that passion front and center, you start simple. So you start with an introduction. You explain the context of who you are, what you do, and why you matter to that legislator. Do you live in their district? Do you work in their office's neighborhood? What do you do every day? So we have to remember that legislators do not necessarily know what a neurologist does from day to day. They may not know, for example, that neurologists don't do surgery. We are definitely not neurosurgeons. They may not know that for many of us, we have had to do years and years of fellowship training to be able to practice and treat very specialized patients. And they may not realize that a large proportion of neurologists actually serve as their patient's primary care provider. They may also not know that because many of our patients are so complex, the routine hi and bye of some physician interaction just does not work in our own daily practice. We have to work with families, case managers, therapists of all kinds to get our job done. And that's okay. It is up to us to explain who we are, what we do, to our legislators, and to provide them the context from which we are coming from. All right. Then it's all about the story. So never diminish the power of a good story. So you have to realize that legislators and their staff are like super tired, right? So they're all day long sitting in meeting after meeting, listening to people ask for one thing after another. And every person they meet thinks that their issue is the most important in the world. And throughout all this, they have to remain patient, polite, and kind. So their job is definitely not easy. And so we make it a little better for them by telling them a story that grips, something that is true, something from the heart. So maybe it's a story about an 80-year-old grandmother who suffered from a stroke that took away her ability to communicate, but because of telemedicine, you were able to essentially reverse her deficits so that she was able to talk to her family within minutes of receiving life-changing thrombolytic treatment. Maybe it's a story about how step therapy is cumbersome and ineffective and prevented your young MS patient from getting her necessary effective treatment in a timely fashion. Or maybe it's about how, as a doctor in private practice, you are overburdened with administrative tasks and paperwork, and it limits the amount of time you are able to spend with your patients, and you are experiencing burnout as a result. So remember, we humanize what we do and what we ask for when we tell stories. And it is a lot more conducive to forming a relationship with the legislator, which is ultimately what we really want to do. In the end, after you leave, you want them to remember you. You want to be able to reach out to their office and know who you are. And they are much more likely to call you if they have any questions related to something about neurology or medicine. Okay. Then after the context, after the story, you give them the ask. All right, so there's a couple of rules to think about what that ask might be, and you should do this ahead of time. The ask has to be simple, and it has to be easily understandable. So, as an example, take prior authorization. So most people understand that when physicians prescribe medicines or procedures, it's because they're necessary. And we want to make sure that there is transparency between what is needed by patients and expediency between getting studies and medications approved quickly. So legislation to streamline prior authorization and standardize the process by which medications are approved is a super easy ask from a physician to a legislator, because it makes it easier for our patients and their constituents to get the services and the treatments that they need quickly. Secondly, you want to make sure that your ask is timely, meaning that it's a tangible issue that is happening now with a goal that is attainable in the near future. And that also means that the ask is actionable, meaning that there's something potentially on the table or nearly on the table that you can ask the legislator to take action on. For example, it might be a bill on step therapy that's been introduced, and you can ask the legislator to co-sponsor. That is an actionable and timely ask. And having something to point to that the legislator can say yes to is golden. Finally, the ask has to be relatable. More than anything, we want to enact change that's going to affect most neurologists for the better. Yes, we may have our very specific, remote, and unique wants and needs, but on this front, it really is better for the ask to be something relatable so that all neurologists or all doctors, or most of them, can relate to what you're asking for. So this is actually something that we work on at Neurology on the Hill, which is an annual incredible event that takes place in DC that you may have heard of. But I want to encourage all of you to think about what matters to you and what your ask could be so you can speak about that for yourself. All right. So after all that, you open it up for questions, and then you get to talk one-on-one with the legislator and their staff, or more likely than not, that's all the time they have. But you will have done it, and you will have given your context, your story, and your ask. And most of all, you'll have had that conversation, and you'll have made that connection. And if you make that connection, you can form a relationship. So, after all that work, Make sure to solidify the impression you've made by following up, thank them for meeting with you, share any additional information that they asked for, and offer to be a resource going forward. And hopefully in the future, you can be that trusted resource for that office on all things neurological or even medical. Luckily for all of us, the AAN has a very experienced and passionate advocacy team that is ready to work with you on all your big and small ideas. All you have to do is reach out to them. Besides Neurology on the Hill, we have the Palatucci Advocacy Leadership Forum, which puts neurologists through a rigorous training program of communication skills, goal setting, and relationship building. It has been a real inspiration to see PALF graduates coming up with their ideas and seeing them to fruition. And if you have ever been interested in this program, I hope you will consider it because it is awesome. I think it is life-changing. And I'm very excited to say there's an international pilot program of PALF that is starting at this very conference called the Global Advocacy Leadership Program. This brings together neurologists across the globe with seasoned AAN advocacy faculty and staff to develop and work on individual projects. And I cannot wait to see where this collaboration with our international members will take us. I also want to remind you that advocacy can be as simple as sharing education with your patients and urging them to read accurate health information. I know I'm biased, but Brain and Life is a free magazine published by the AAN with neurologists, excellent neurologists, helming the editorial board, and it is a great source of accurate health information. We write and review every story carefully, and we put patients first. There's an awesome podcast, we have a social media team, we have a website, and we have some new initiatives in tow for the next couple of years, so please stay tuned. And please reach out, go to the Publications Hub, we have lots of copies, we'd be happy to send copies to your office. Again, they are free for all of your patients and for you. All right, so I hope I've made it clear that everyone here can be an advocate. You just need 4 things: an idea, a story, an ask, and a follow-up. How you get there is up to you. And with that, I will hand this back to Dr. Jackson. Thank you.